I'm Dr. Seth Eberlin. I'm a board certified plastic surgeon here in Walnut Creek, California, and today we're talking about facelifts. Now, one of the reasons I wanted to address this is because if you go online and look up facelifts near me or plastic surgery facelifts, there is a really wide variety of different procedures that kind of fall under this umbrella. And for me, I think the most important thing when we're talking about this is restoring the normal anatomy. I harp on this all the time when we're talking about consultations because it's really important to focus on your anatomy and putting things back to where they came from versus trying to force your tissue in a direction it didn't used to go or to try to change the shape of your face. Once you start going down that path, then things start to look unnatural, it starts to look done, it starts to look pulled, or it just starts to look obvious that you had surgery. And I think all of those things are kind of counterproductive to what we want. Going back to the anatomy of it, once we understand what's happening with the anatomy, then we can talk about how we fix it. And a lot of this is based in the neck. There's a muscle called the platysma muscle in the neck, and it basically goes from your collarbone up to your jawline. And it's this muscle right here. It's responsible for the circumference of our neck. Now, over time, those muscle fibers that are nice and tight and vertical together, they kind of split and relax. And as they split and relax, it makes the circumference of our neck bigger. In addition to that, as that muscle relaxes, it kind of pulls down on our face, and that is what changes the shape of our face. So if we look at this mother and daughter, if we look at these little fat pads that they have in their face, the daughter's fat pads are all nice and tight together, high up where they're supposed to be. The mother's has gone through this kind of descent where they're thinner and they're lower. And what that does is it takes our facial shape from more triangular shaped with a more defined jawline to more square with more volume down here that's kind of blending into the face. That guides us directly in the how do we fix this procedure? Because what we end up doing is obviously everybody's different, but primarily we make a little incision under the chin. That lets me go and identify that platysma muscle, this guy right here, and take that muscle where it's split and perform what's called a platysmoplasty, where we're tightening that platysma muscle back up to where it used to be. There's an incision that starts in front of the ear. It goes behind this little piece of cartilage. That's really important, and we'll talk about that in a second. It goes up in front of the earlobe and then back behind the ear. That lets me access the system of fat pads here and tuck them back up to where they used to be. So if in your face the fat pads used to be like this and they kind of slipped and dropped down, all we're doing is piecing them back together. I'm not going to be moving them somewhere they didn't used to be. I'm not going to be doing something that's non-anatomic. The whole idea is just to restore the normal anatomy. Now, once that platysma muscle is tightened and once those fat pads are elevated into their original position, then we do what everybody thinks, which is remove the extra skin. But once those fat pads are lifted up, we have all this extra skin that sits around our ear, and that's where we use that periauricular incision to remove it. Now, one thing I talked about was the incision going behind this tragal cartilage, behind this little piece of cartilage in your ear. And that's very important because if you go straight down in front of the ear, you're gonna see an incision that goes right in front of that cartilage, and it looks very obvious. We want to try to follow the contour of the face. So there's a natural junction point between your ear and your face that we can work in front of, but then we go behind that cartilage and then in front of the earlobe and back up behind the ear, so the incisions are really well hidden. In addition to not disrupting the normal anatomy in the face, the incisions are of paramount importance because if you have a bad scar, I think that you're gonna have a bad surgery. You know, it doesn't matter how good the shape of your face looks or how tight or snatched your jawline is. If there's an obvious scar in front of your ear, it defeats the whole purpose of it. Now, a few questions that I often get during consultation. Number one, do we have to shave any of my hair? The answer is absolutely not. We're not shaving anything. I always end up kind of sewing up in the hairline. So I work with your hair. We're not cutting anything. We don't shave anything because that would make recovery take longer. Number two, are there any staples or stitches to be removed? There isn't. Everything is underneath the skin. Everything is dissolvable. And number three, do we have to use drains? I don't use drains. I don't think they're necessary. I think there's a lot of kind of techniques that we use in the operating room and kind of small nuance changes that make it so we don't have to use drains. And drains are uncomfortable. They can potentially be a site for infection. And honestly, they're just kind of gross and people don't like to have them. So it's nice to not have to use those. As far as recovery goes, I like to think of recovery in a few steps. The first step is how long are we on pain medicine for? Pain medicine actually is usually only for a day or two. It tends to look worse than it is. Our face gets pretty puffy, but it's not as painful as you would think. So pain medicine usually for a day or two. The social recovery, when can you go out into the world and have people look at you and not say, oh my gosh, what happened, is usually 10 to 14 days. Now you'll feel much better, you'll feel pretty good after 5 to 7 days, but just that social aspect of recovery is usually around 10 to 14. The next step of recovery is if you have an event or a wedding or a vacation or something big coming up, give yourself 4 weeks. 4 weeks is plenty of time to heal the incisions, to get rid of most of the swelling, for most of the tightness in your neck to go away. You're not done healing, but you're gonna look and feel really good at 4 weeks. The completion of healing, when are we done with this whole thing, is usually like 6 to 9 months. And that's a long road, but that's why I tell people you're gonna look and feel really good after 4 weeks. The main complaints I get at 4 weeks, the main things that people come in and say, this is still bothering me, it's usually a little bit of numbness in front of the ear, and that's just because the nerve that goes to that area kind of comes out and goes around, and we're stretching it. So, and the nerves get stretched, they shut off, so it takes some time for that nerve to wake back up. The other thing I hear is tightness in the neck, and just that muscle, that platysmal muscle that we've tightened up. When you're turning your head, if you're in a car trying to look behind you, it can feel a little bit tight. That will always go away as far as the sensation of tightness. I'm not saying that it's going to get loose again visually, it's just that sensation of tightness go away. And this leads us into another question that I get, how long does it last? And it's not that a facelift lasts for a certain period of time, because it's not like it's going to work, and then all of a sudden it falls apart. I like to think of it as setting the clock back. And it usually sets the clock back anywhere from 10 to 15 years. So if we're moving along this aging pathway, and we set that clock back 10 to 15 years, and we continue to move along that aging pathway, 10 to 15 years from now, yes, there's going to be a little bit of loose skin. Yes, there's going to be a little bit of laxity under the chin. Just because our tissue is not stagnant, it is definitely kind of a dynamic structure, so it's going to change over time. But our set point is now 10 to 15 years ahead of where we used to be. So as we age, we're going to kind of perpetually be 10 to 15 years younger. The biggest complications that we could potentially see are wound healing issues. Now, when I'm doing this, I don't put any tension on the front of the ear. These incisions are of paramount importance. If I'm putting any tension on the skin, it's behind the ear. So if there's an area that's going to heal more slowly, it's tucked up behind the ear in an area that's already very pink and in an area that already has little contour changes. So if something isn't going to heal perfectly, I want it to be behind the ear where it's not going to be noticed by anybody. Something I hear a lot in the recovery process is, I thought it was going to hurt more, and often I should have done this sooner. It takes a long time for somebody to kind of pull the trigger and decide, I'm committed, I'm going to do this. But when somebody's looking in the mirror and they're doing this every day for 5 years, and then they come in and do the surgery and they don't have to do this anymore, that's 5 years of their life that they spent being unhappy that they didn't really have to. So, I'm not one to do preventative surgery or surgery too early. But I think once it's bugging you enough to be looking in the mirror and saying, I'm starting to see my mom or my dad looking back at me and this is really bothering me, that's when we want to come to tighten it up. And what we're really doing, like I said, is just restoring the normal anatomy. We're taking the volume that has fallen down and kind of getting it back up to where your cheekbones used to be. We're reestablishing the jawline, or the definition between the jaw and the neck. And we're just basically getting that tissue back so you look like a refreshed version of yourself, not like somebody else. Now, if this is something you want to hear more about, don't hesitate to reach out. We are here, and we'll be releasing more of these videos on the following months.